Fibrodysplasia ossificans progressiva, also known as the stone man's disease. This poster is made to highlight the rare disease of Fibrodysplasia ossificans progressiva, colloquially known as the stone man's disease, which is characterized by the skeletal muscle and connective tissues turning into bone. Although being discovered in the 18th century and with 4,000 cases estimated today, only about 900 are recorded, which prevents from so much research being conducted. As a result, any breakthroughs made have been within the last 30 years, and mostly by Dr. Frederick Kaplan and Dr. Michael Zasloff. Only affecting about 1 in 2 million people worldwide, Fibrodysplasia ossificans progressiva, or FOP, is a rare disease that turns connective tissues and skeletal muscle into bone. Extraskeletal bone caused by a mutation within the ACVR1 gene makes life so extenuatingly difficult for the patient and their loved ones. Those who have been plagued with this disease are often bedridden by 35 and only live about 20 years after that with a life expectancy of 55 years, which compared to the mean lifespan worldwide of 72.6 years is very low. Unfortunately, this disease is often misdiagnosed before it becomes severe and is therefore mistreated, only hindering the patient more and also often resulting in more rapid progression of the effects of this disease. There are many treatments going through the research and development stage of production, and some have even reached clinical trial. FOP patients must be extremely cautious as they go through life, avoiding any form of trauma, such as bumps, falls, or accidents may cause a rapid flare-up in the affected area. Since this is often not caught during early childhood, the rambunctious nature of young children often triggers the abnormal bone growth, which can be seen prominently as they grow. Joints will fuse together as their condition progresses, making movement unimaginably difficult until the condition has resulted in complete immobilization and often nerve damage. Hearing loss was exhibited in about 50% of the recorded cases, and in the most extreme, there was cognitive delay and hair loss. The advancement of FOP also allows for increased susceptibility to heart failure, lung disease, and the effects of influenza and influenza-like diseases can be life-threatening. Homeostatic imbalance and cause. Mutation of the ACVR1 gene in the bone morphogenic protein can be inherited, and it is in an autosomal dominant pattern, but is also sporadic. So while this can be inherited through your family, often cases have no previous patients within their family. Fibrous tissue such as tendons and ligaments will now become ossified because of trauma, and things of that nature will cause dramatic flare-ups in the area. So if a patient were to get punched in the arm or fall, they would now start to form a cyst-like bone that you could see under the skin. And viral illnesses such as the flu can cause flare-ups. Classic symptoms include a malformed big toe that is often pointed at an angle, or it is extremely short. You have a short femur or deformed cervical vertebrae. The first sign is usually heterotropic ossification, where you can see firm, tender swellings under the skin, where the mature cartilage is starting to form into bone. There's pain and stiffness, sometimes fever, and more often than not, chronic swelling. Some diagnostic tests that have recently come to light is the definitive genetic testing, which tests for the presence of mutated ACVR1 genes and is commonly misdiagnosed, leading to lifelong disabilities and extreme pain for the patients. because biopsies and other diagnostic tests that are done before commonly lead to flare-ups. And since most patients do not have children or die before they are able to, this is why it is common that there are no previous cases within a family line. And this is rarely detected before the onset of the visual heterotropic ossification, where you actually see the bone growth under the skin. There are currently no known and approved treatments. However, there are many clinical trials and investigational therapies underway. Most of the treatments and remedies now are to help cope with the pain. Patients also may benefit from occupational therapy and aids such as braces and canes to improve their quality of life. This is a mentally and emotionally draining experience for the patient and their loved ones, so counseling has also been super recommended for treatment. And high dosages of corticosteroids, such as prednisone, have helped minimize flare-ups when taken within the first 24 hours of symptoms. So on the left, you can see the growths that I was talking about that can be seen from under the skin. And on the right is the skeletal view of someone whose cartilage and tendons started to calcify. Thank you.